Good afternoon and welcome. Thank you for joining us on this powerful and unifying platform, Mental Health Action Day 2025. Across the country, around the globe, citizens are gathering just like we are, committed to turning awareness into action and conversations into care. 5 years together on this journey, 5 short years. It's been an amazing ride. I'm Kasim Yorn, Director of Ryan's Office of Veteran Services. Here in Little Rhodey, where our size continues to be our strength. Our beloved Ocean State's population is one-ninth the size of New York City. We can get the right people in the room. Today, we've assembled a lineup of change agents, mental health advocates, and leaders across both government and the private sector who are making a difference in the lives of Rhode Islanders every day. The collective impact makes Mental Health Action Day more than an event, it's a movement. A coalition of thousands of nonprofits, companies, agencies, and leaders across 32 countries are working together to amplify one clear message. Just like our physical health, our mental health deserves attention, care, and action. We know that assistance look different for each of us. We're here to offer tools and resources. Remember, it's still okay not to be okay. I am my brothers and sister keeper, and keep Jesus in our hearts forever. This year's theme, check in with someone, centers around the word ask, a framework. Acknowledge, recognize the signs and struggles of others may be silently carrying. Support, offer help in real, tangible ways. Keep in touch, stay connected, do those health and wellness checks. Consistency can save lives. Today's virtual gathering is more than a program. It's a platform for new ideas, shared experiences, and practical solutions. The perspective shared today will reflect the power of small actions. Done often, can lead to real, lasting change. Let's be honest, these are troubling times. Political tensions, economic stress, worrying and uncertainty about everything, everywhere, everything. But when we lead with empathy, when we commit to checking in with ourselves and with others, we build a culture of care and connection. This is why I serve with humility. It's crucial to recognize the mental health challenges that manifest in everyday life, profoundly impacting the well-being of our children and the teens along their life's journey. It's so important that we're taking the steps to be true to ourselves, our friends, our family, and coworkers. We should be supporting each other and empowering one another. I've experienced this firsthand. My story has deeply shaped my personal and professional journey. It's unlike anyone else's story. I've been a Catholic, father, a brother, a person who served our nation, a taxpayer, an appointed official. We stand together as one team. Now, I have the honor of introducing someone whose leadership and support has been unwavering. Governor Dan McKee, more than my boss or the 76th governor of our state. He's truly an advocate for mental health and a friend of our veterans and military families. Governor, good afternoon, sir.
Good afternoon, Director. Good to be here with you.
Yes, sir.
Well, thank you so much. And your Kasim Yan's, Director Yan's leadership on this issue, always making sure that we're bringing together the veteran service officers along with BHDDH, along with EOHHS, championing the mental health issues. And I love the ask strategy, right? Which is the acknowledge, the support, and then keep in touch. I think that's really very wise, simple advice. And so today I wanted to just recognize that we're in Mental Health Awareness Month. Today's Mental Health Day is the Day of Action. And it's important that we highlight the work happening in Rhode Island to support those in need. This past year, we worked with the Secretary Charest, along with Director Leclerc, to open 8 new certified community behavioral health clinics, to expand behavioral health care access for all Rhode Islanders, regardless of age, insurance, immigration status, or diagnosis. I'm also excited about a new grant program that the director and I talked about off air through EOHHS and the Rhode Island Foundation, which is offering $2.5 million in awards to address the opioid crisis, which we know is still front and center on our minds, and how it's impacting individuals, families, and communities in the state of Rhode Island, and a national issue. This is a much needed and timely collective effort to save lives and to help those in need get back on their feet. And I encourage organizations that may be listening in to take advantage of this opportunity and help those in need to get resources and support that they deserve. In cooperation with RIDE and the Health Department, we've partnered in with Hazel Health to offer a first of its kind virtual mental health support in our schools at no cost to our families. And we're reaching thousands of students on this very issue that we're really promoting this idea of ask. Let's acknowledge, let's support, let's keep in touch. And we're doing that in our schools, and it's a great partnership between Hazel Health and RIDE and the Health Department. So I thank the leadership there. Just 3 years ago, we worked with Director Yan and the Office of Veteran Services to open a 15,000 square foot facility dedicated to giving brave men and women who served our country direct, comprehensive access to mental health resources. And in my budget this year, I am proposing $1.6 million funding to the 988 National Suicide Prevention Lifeline. This is a life-saving resource that has helped thousands of Rhode Islanders in crisis get the help they need so they can keep themselves and our state safe. Rhode Island committed to addressing these issues head on, and we're committed, and we continue to be committed, and thanks to the efforts from our agencies, from all Rhode Islanders, and from all Rhode Islanders, we're breaking down barriers to provide the help that is needed. Our administration remains committed to building a prosperous future for our families, children, workers, and veterans. And we have a Rhode Island 2030 plan that I keep this right on my desk for people to take a look at because the issues we're talking about today are prominent in the health sections that we have put forward, and we're working on our fourth draft to let people know that we're trying to raise the academic outcomes for our students, raise incomes for our families, also raise personal wealth, particular focus on home ownership for people, and then making sure we're healthy enough to enjoy living in this great state that we are fortunate to be able to live in. And so that health piece is a prominent spot, and you can see how we're supporting that not only through our words, but also through our funding. And so I want to just kind of again, reinforce the theme today, invite everybody to take a look at this Rhode Island 2030 plan, ri2030.com, and really know that there's a plan in place, and it's one that is going to really help strengthen individuals, families, the communities we live in, and the state in particular. So just let's reinforce, the idea on this Mental Health Day of Action that it's okay not to be okay. And that's what Director Yan just said in his opening comments. And the idea of ask, acknowledging how people are feeling and what they're experiencing. Support them by asking what they need, and keep in touch so that they know they can rely on individuals to provide them support. And doing this is support is great work, and we've done this on a state level. So everybody that's listening in who is participating in this effort, I want to thank them on behalf of the people of the state of Rhode Island. Every single one of us has a good days, and we have our down days, but Rhode Island stands ready, and it stands by the people that are listening in and those who are not listening in but need our help. So let's take another step forward on Mental Health Day of Action and reach out to those in our lives who may need a little extra boost. And thank you, Kasim, for having me. And I do have to point out that Kasim will be recognized for a lot of this work this weekend at Salve Regina, where he'll be given awarded a doctorate. And congratulations, Kasim. I think that part of this work is what is being recognized this weekend. And that's why I bring it up to thank you for your leadership, and thank you for the invite to be here today to reinforce this work that is so important to the people in the state of Rhode Island.
Thank you, Governor, for your steadfast leadership as well. And your presence here ensures that, this is a priority. Leadership from the front. Thank you again, Governor. Let me tell you about a game changer that's happening here in Rhode Island's mental health landscape. The launching of 8 certified community behavioral health clinics, or CCBHCs, providing Rhode Islanders with strategic placed healthcare clinics across the state. CCBHCs also offer service members and family members access to veteran service officers, VSOs, in different parts of the state. Veteran service officers are trained and equipped to help veterans navigate access to benefits and provide mental health options. Tom Martin, my dear friend, for Island's Department of Behavioral Healthcare, Developmental Disabilities and Hospitals, BHDDH. We're so pleased he could join us today to talk about all the great work happening with this newly created clinics. Tom?
Director, can you hear me?
I can hear you, sir. Absolutely.
I don't know if my camera's working. Is that? I'm just checking and keep clicking it to work, but it won't.
Well, as Tom's working through those things too. So, Tom, can you hear me?
Tom, if you turn your audio back on, and I can bring you on the way that you just were. There we go. And we will just do audio for you. That is fine. And I know that you have a script as well. So just worry about the audio. We don't need the camera.
Okay. You have my slides too?
There we go, Tom. We do have your slide.
Right. I got it. Okay. Thank you. I'm sorry for the technical difficulties here. I apologize. But first of all, I just want to offer my thanks for Director Yan for the invitation today, as well as I want to thank the governor for his ongoing support for behavioral health in our state of Rhode Island, especially in the investment in Rhode Island certified community behavioral health clinics. So if we go to the next slide, we look at certified community behavioral health clinics and what that means. So this is the state's approach to a no wrong door approach to having behavioral health services for all ages, regardless of insurance status. So anybody of any age can apply for behavioral health services, mental health, or substance use, and be given immediate access to services. There are 9-10 core services that we are required by CCBHCs. As you can see on the slide, there's emergency services, mobile treatment, general outpatient services, substance use, primary care, family-centered treatment planning, behavioral health screening, assessment and diagnoses, targeted case managers, psych rehab, and of course, community-based healthcare for veterans. And this is one of the game changers that the director and BH have been working on to make sure that veterans have access to services that they weren't getting access to in our previous system. And again, there's also peer support, peer counseling, and family caregiver support. So CCBHC implementation, it started in October 1st, 2024. We have 8 sites, 6 providers. We have 2 in Providence. 91% of the state is covered with a CCBH client. Individuals have access to CCBHC. The East Bay area, we're working on to devise a plan so that everybody can have access in that area. Those in that area that don't have access can access another CCBHC in the other 8 sites that we have. And then what to expect from a CCBHC. So one of the main thrusts of CCBHC is mental health, substance use, mobile crisis response 24/7. So that means that we have a mobile response unit that can go out into the community and see you in the community for their mobile response. We have a specialized program for youth. It's called Mobile Response Stabilization Services. And it provides 24/7 mobile response. It also provides 30 days of stabilization. Our response for adults that is 24/7 is a 2-person response that is based on the SAMHSA-based evidence-based practice for mobile response. So once again, seeing people in the community keeps them away from the emergency room, provides immediate access to treatment, and again, keeps people getting treatment in the least restrictive setting, causing less trauma and less trauma in their lives. And then the other things to expect is open access appointments. So each CCBHC has to have 50 hours of open access appointment times, and that is to decrease time and services for waits. It also improves access and gives individuals immediate access into services. One of the things about having immediate access to services, there's criteria, meaning that you have 10 days to get an appointment for services. Those are things that weren't in our system previously. People had wait times. There were no restrictions or requirements on wait times. This provides us a criteria. To be a CCBHC for a routine appointment, you need to be seen within 10 days of the request. We also have requirements for emergency response times, that people have to be seen within an hour of an emergency request. Those are the kind of things that are new and game changers to our system. In addition, we have evidence-based practices that we've implemented in our system. We have team-based services that are community-based to help individuals with serious and persistent mental illnesses, co-occurring diagnoses with substance use and mental health that are ingrained in the community and not in the office-based services. And the other things that we have are better care coordination services between social supports, such as we have individuals trained to assist with SSI and application for veterans benefits. And lastly, we have increased outreach to the community to engage individuals in need of services for homelessness or those that are housing insecure. Again, we're looking at social determinants of health. We're looking at what the whole person and providing comprehensive services without delay in access to service. So that's the CCBHC landscape as we know it now. There's our contact information for questions or comments. So please feel free to reach out to us and we'd be glad to respond to any of your questions. And thank you again, Director Yan.
Thank you, Tom. Always a pleasure, sir. We know that it's moments like this, moments in crisis. Speed saves lives. That's why the 988 Suicide and Crisis Lifeline is critical. It's more than a number. It's a lifeline. 24/7 support is just a call, a text, or a chat away. Joining us now is Rosie Fremer of Horizontal Healthcare Partners, a 988 responder, Navy veteran, go Navy, and champion for those in crisis. Rosie?
Hello, everyone. This is Rosie coming to you live from Newport. I'm here to talk about 988 and what 988 is. It is 24/7, 365 access line for anyone who's feeling sad, lonely, needs someone to talk to. You have roommates you want to complain about. 988 and just let it out. Don't hold it in. It is confidential. We're not able to see where you're calling from. We're not like 911 where they can see your location. 988 is free. It's all ages. We have children who call. We have, adults that call. We have people who are older citizens that call. It's literally available for everyone. So please make sure that you guys call 988 and that you guys know that it's a free service. Also, 23% of the calls that we get into 988 are on behalf of someone else. So if you are calling on behalf of a veteran or yourself, you have the option to press 1 for veteran services, or you could just choose to not identify as a veteran. You have that option, and it's all free 24/7. It's available nationwide. So even if you travel to another state, 988 is available for you. Thank you, Kasim.
And thank you, Rosie. And thank you to every responder who answers the call. Our next speaker has shaped groundbreaking public health programs that are models for the nation, from Vaccinate Before You Graduate to the Rhode Island Health Equity Framework. She's led with vision and compassion. Please welcome Anna Novice, Assistant Secretary at the Executive Office of Health and Human Services. Anna has her own personal story that has propelled her career in her direction. Anna Novice, good afternoon. Boa tarde, my sister.
Boas tardes. Thank you so much. Good afternoon. I truly appreciate your leadership into this issue and the creating the space and the table for us to have these conversations. As Kasim said, I'm Ana Novaes. I am a psychologist by education and training, and worked as a clinical psychologist for many years, since back in more than almost 40 years ago, in Cape Verde, in Portugal, and then in the United States. My first encounter, in fact, with the United States, the first time I came to the United States, many people heard me say that I came to take care of my sister. My sister had a mental health breakdown. She had a depression, and I came to be with her. And it's a place that we find ourselves many times, because mental health is such a common disease that we all have a family member, know someone that we need to at some point take care of, support, be there for them. And so as I came to be there for my sister, I've really was faced with a behavioral health system that was not the best, I must say, more than 30 years ago. And so that really led me to really commit to continue to work in this space professionally of changing our behavioral health system, our public health system. And I've learned with everyone in this space and throughout the years. But we, in specifically the space of behavioral health, have been making strides of late in Rhode Island. And I am so proud of the work that we've done in this state. My colleague, Tom Martin, has talked about the CCBHCs. The governor at the beginning mentioned the opioid grants. And that's one area where I think Rhode Island has made so much change. And that's due to the work and the investments that we've made in the state. This $2.5 million grant that we were referring to in partnership with the Rhode Island Foundation is really going to continue to support our community, our community-based organizations in partnering with us in addressing the opioid overdose epidemic that we've had in the state. We are seeing for the first time for the past 2 years impact and a change in the numbers, with the numbers going in the right direction, with a decrease in the number and the rates of overdose deaths, and that's thanks to the work. And so this funding and this grant will support groups of parents, will support recovery, will support youth services, and it's a great it's a great investment that the state needs to continue to do. We are also focusing in terms of looking at the state's behavioral health system of care. As a sector, the governor had signed an executive order last year in March directing UHHS to do healthcare planning, meaning take a deep look at how the healthcare system is organized in the state. And we're doing that in a variety of sectors. Hospitals, primary care, long-term care and support services. We're looking at the socially related needs, and behavioral health absolutely is one of those sectors that we're looking at. And so we took a deep dive into behavioral health, and we are looking at how can we respond to the behavioral health system, both on the adult side and on the children's side. We are meeting with a group of providers and stakeholders, and it's a public-private partnership, trying to come up with we have very specific set of recommendations on how to improve the healthcare system, what is our safety net looks like. And the last thing I would like to highlight, which they took the slide away too soon, is truly our behavioral health website that was created in partnership with all of our other state agencies, and mostly informed by our parents that we serve, the youth that we serve. And it's really focusing on resources for parents on how to address behavioral health for their children. They would have a series of resources, questions to ask when they don't know for sure, is this okay or is this not okay? That website gives folks all of the resources and helps them engage with the provider, with their children, with the schools, in order to address their children's behavioral health. So today, in this day of action, I wanted to share all of these resources with you. And I appreciate the time. And I would like to finish with one remark. When we talked about at the beginning, Director Kasim talked about ask, the acknowledge, the support, the keep in touch. And that's a huge national campaign. But if you think about it, it applies to any individual in our families, in the communities that we serve and that we work with, always acknowledging that and seeing the person in front of us, seeing the person, acknowledging and asking, are you okay? What's going on? As a professional or as an individual, and as a partner, as a friend, as a caretaker, and being there to support. And it's not a one-time thing, because many times this is a journey, and these are journeys. We need to keep in touch. We need to keep asking. We need to keep supporting. And so thank you, Kasim, for everything that you do by acknowledging, by supporting, and by keeping in touch with us, with the community you serve. We appreciate you. Thank
Do
you.
y'all see why she's so amazing? Do y'all see why she's so amazing? Thank you, Anna. Your work continues to move our state forward. Rhode Island is proud to be supportive of our governor's challenge work to prevent suicide among our service members, veterans, and military families. A valid initiative that includes the Staff Sergeant Parker Fox Grant. Here to speak about the important work is our state's top health official, Dr. Jerome Larkin, Director of the Rhode Island Department of Health. How are you, Doctor?
I'm good today. Thank you so much, Kasim, for inviting me today. It's really been, I've been watching all along, and it's really been inspiring. Anna's always a tough act to follow, so I got to work on that, see if I can somehow switch it up a little bit. So I would like to talk a little bit about some of the work that we're doing here at the Department of Health. We have a number of programs. And if you go to the next slide, sorry for saying that. So, I think the thing to always understand, and I do love the model of the ask, sort of acknowledge, support, and keep in touch. Because really, mental health issues are a part of the human condition, and they have a huge impact on the lives of individuals, as well as all the people around them, their families, their communities. And actually, it is really keeping in touch with that person that I think is going to be most impactful on their ability to surmount some of the challenges they're facing. So it really affects people's ability to live fulfilling lives. It often depends on their mental health. So this makes protecting and caring for our mental health and the mental health of others an immediate concern to public health and professionals. So we are the recipients of one of the Staff Sergeant Parker Gordon Fox Veteran Suicide Prevention Grant. So I want to talk a little bit about that program. It was $174 million allocated by Congress for 3 years of programming in different states. But I think it's also important to talk about the person. So Parker Gordon Fox was a veteran. He was born in 1994. He joined the military in 2014. He served in Italy and then was a instructor at Fort Benning in Georgia. He died by suicide tragically in July of 2020 at the age of 25. What the program does is it identifies grantees to provide outreach to those at risk of suicide, provide baseline mental health screening for risk, education on suicide risk and prevention to families and communities, provision of clinical services for emergency treatment, case management services, peer support services, which oftentimes are one of the most critical aspects of intervention in mental health issues, because nothing is quite like someone has had the same experience of you. And then also VA benefits assistance for eligible individuals and their families, and a lot of other things. So we are in the process of rolling this work out. About 15% of all suicide deaths in Rhode Island are identified as veterans or military service members, which comes out to about 15 deaths per year. And we are really excited to be doing this work. The grant enables us to work collaboratively with Veterans Affairs, community organizations, as well as our partners at EOHHS and BDDHD to work in this sphere. So what are we doing? We have outreach to partners with community organizations to meet veterans where they are. We provide case management and funding for participants. And you can learn more at our website there, health.ri.gov, Help for Vets. And then lastly, we are launching a campaign in June to specifically address mental health issues in men. And it's called You Good Man? Sort of that initial question in the ask paradigm. And next. So we're actually looking to understand how men talk about mental health and what resources are helpful to them. So if you are 18 or older, male, and live in Rhode Island, you can take the survey on this by scanning this QR code. I believe the QR code is also on our website, but if not, a quick call and we can connect you with that. And participants will be entered to win gift cards and raffle prizes. I don't know, you may want to post, well, I guess they can find it in the video posting. So anyway, Director, thank you very much.
Doctor, are you good?
I'm good.
So we talk about, we all share our personal stories. Talk about your passion for the arts.
My passion for the arts. Yeah, so I have spent some time in community theaters, a bit when I was younger in high school and college. And then recently, excuse me, allergies. I've gotten more into it in the last couple of years. And, you know, it's actually finding that outlet, I think, that really helps us all keep an even keel, if you will, as a Navy man. And actually last night, I got invited to Cedar Crest, I think it was Cedar Crest Nursing Home, to sing for some of the residents. So that was fun. So that's my passion for the arts.
That's awesome. So everybody got a
You froze, Kasim. Sorry.
I think the director froze for a second.
I'm here.
Thank you, Doctor. We're good. Thank you
There
so
we
much. Be honored here. We're back, Doctor.
I'm back.
Yes, thank you so much, sir. We're honored for your work alongside you and your team.
Thank you for all your work you do and for your great team.
You know, team, mental health doesn't stop at a clinic. It's in our homes, our communities, and within our families. The Rhode Island Department of Human Services is expanding services to meet these needs head on. Please welcome Dr. Donna Rourke, Administrator for the Family Adult Services at DHS. Doctor,
Hi.
how are
Hi.
you, man? Welcome.
Thank you. Thank you so much, Director Yarn. Again, my name is Donna Rourke. I am the Administrator for Family and Adult Services at the Department of Human Services. My career pretty much has spanned between safety net programs and behavioral health. So both of these are very important to me, and I feel very necessary for all the families that we serve. The Rhode Island Department of Human Services provides critical support for families and individuals through programs such as SNAP, Rhode Island Works, the Child Care Assistance Program. We provide the safety net programs to assist with food, household income, and specialized health insurance, the baseline for families and what they need to succeed. What we know about chronic insecurities and poverty is that the mental health impacts of persistent poverty should not be overlooked. We know that chronic instability affects the brain development in children that will last a lifetime. So this is the time to try and address it and provide for those needs that families need to support themselves. Prolonged exposure to chronic stress and the brain and trauma and insecurity will lead to increased rates of depression and anxiety. This is for adults and children. When events don't mirror the lives of others and expectations are consistently disrupted, thought processes and decision making become based on the moment. the anxieties and stresses of the moment, the people make decisions to alleviate them immediately without looking at the long-term results or long-term solutions to the problem. This causes a pattern that causes people to live from crisis to crisis. The learned decision means that people's lives are more likely to have traumatic events in them. What our families tell us, we collect data, both qualitative and quantitative. We do a deeper dive for families who have multiple barriers or who have been on our programs for extended periods of time. We ask them what their experiences are. Stressors prevent families from exiting safety net programs. The top 2 reported stressors are mental health barriers and stressors over housing stability. Families report that stressors occupy both their time management, their ability to focus. So, these are impacting their ability to stabilize their lives. We want to spread the word that you can check in with us. DHS is expanding services directly to address the mental health concerns of our families. We're establishing multiple touch points to meet mental health needs of our families. This is being done and accomplished in the following ways. We're providing workshops to DHS staff to learn about the symptoms and what they expect to see when someone comes in, what they're expressing in front of them, to recognize that they are symptoms of mental health and how to appropriately respond to them, to understand the effects of mental health on a family's ability to stabilize themselves, why we see people in our programs for long periods of time, why those decision-making processes frequently lead to more bad outcomes. We're teaching staff to identify real opportunities and processes for referrals to make sure that people are getting into the right services, which, by the way, the new CCBHC is making that far easier for everyone in the state of Rhode Island, and most especially our families, the ones that we serve. We're building an environment where the importance of mental health is recognized and addressed in a space where safety net programs are provided. We believe that it should be a comfortable place for people to talk about their mental health needs. Programs addressing insecurities such as food, housing, income are not separate and apart from the mental health experiences of our families, and they both interact with each other. So we have onboarded a specialized mental health service provider called Revive Therapeutics. We onboarded them this year, so they're brand new to us. They are focusing on building the family's capacity for training and employment. One of the first steps to help families stabilize themselves. And they're doing this through a specialized caseload for people that need extra supports via mental health supports. The referrals for a network of clinicians who use telehealth technology, who use telehealth technology throughout the through multi-state region here, which helps with another reported barrier from our families, which is transportation. So having that kind of tool in their toolbox knocks off another barrier for our families who are already very stressed due to low income and some of the other barriers that they are experiencing. They have implemented brief and integrated support therapy into a specialized caseload. They focus on the whole family to include adults, teens, and children from the age of 8 years old on up. They provide flexible schedules and meeting locations for families with mental health barriers. First time that you're connecting with a new provider, it is anxiety producing, to meet new people, especially if it's at a new location. So they're providing some flexibility for that initial meeting to help develop that rapport and make sure that the families are connected to services. We're building and expanding the capability or the capacity of DHS staff to recognize and understand and respond to mental health concerns of our families. We want to make this a safe place to check in with us, to add resources and avenues for referrals to address their concerns as the families are reporting to us. The importance of listening to those with lived experience cannot be underestimated. It provides a wealth of information for program and policy building. All of these services that I've mentioned on this slide can be accessed at all of our field offices. So what we want to say is you can check in with us. You're coming in to talk about your cash assistance or your SNAP or your health insurance or your child care assistance program. Please also, let's talk about your mental health needs so that we can make sure that you're linked. Check in with us. Thank you.
Thank you, Doctor. Your advocacy makes a lasting impact for our families across our state. And for additional information and detailed info that Dr. Roy talked about, please refer to our Facebook chat.
Thank you.
Now let's talk about innovation, specifically how technology can support emotional health and well-being. Joining us is someone I met through our National Veterans Network, Dr. Barbara Bendalini, CEO and co-founder of We Life, Inc.
Hello, Director.
Hello, ma'am. You may know the doctor. She is a phenomenal leader in the community. Give an Hour was so special, our National Prevention Initiative. It advises ABC's hit TV show, A Million Little Things, mental health storylines. Doctor, welcome. That's how I say it. Nazareth, welcome to Rhode Island.
Thank you.
Welcome back.
Thank you. Thank you. Well, this is, as you all know, who know me, you are singing my song. This work is so important, and I am proud to be here to talk about emotional health, well-being, and technology. So first, why do we think about technology to address these needs that really have to do with us as humans? All people, we all experience pain, suffering. We all have transitions. We all have challenges. There aren't enough people like me and other mental health professionals to meet the need. There haven't been, there aren't going to be. So we always have to look at how can we use other tools and techniques, capabilities, how can we expand? So technology is scalable. It allows us to implement large-scale projects to scale, which is critical. Number two, it can be prevention focused, meaning we can use technology to educate, to help people build skills, to help people build levels of comfort. We can help them get from feeling like they're struggling to know where to go. So technology is hugely valuable. Artificial intelligence, it's here, whether we like it, whether we're afraid of it or not. There's some really good things on the horizon for us in this space, in the mental health, emotional well-being space. Right now, artificial intelligence should not take the place of people like me and other mental health professionals. We are needed to work with individuals who are suffering. However, that work can be better supported using AI. It can be, people can be better educated to help them get to the place where they go, wow, I really could benefit from speaking to someone. I really could benefit from one of these other programs. So artificial intelligence has the potential, but there are concerns that we need to be mindful of. We need to keep the human in the loop. We need to make sure that people who have the experience and expertise are tracking, are understanding how to better use AI for Okay, I'm back. So here are some examples of companies that Talkspace and BetterHelp are online telehealth capabilities. So you see a doc online as opposed to in person. Headspace provides a number of things like that and resources. And then Weeby Life. So I'm going to tell you about Weeby. So Weeby, again, as I said, the challenge is there are never going to be enough mental health professionals. But here's the good news. There doesn't have to be. If we think differently about how to use the experts we have, we can do so much more than what we currently are doing. We're now chasing after, trying to make sure there are enough mental health professionals to meet the need, and there aren't. And so people like me, who really should only be seeing the people who are most in need, who are critical, we're seeing everybody because everybody's struggling and trying to figure out, where do I get a resource? Where do I get help? So here's what we do. And this is a company that I began building before I went in to lead Prevents, the President's Roadmap to Empower Veterans and End the National Tragedy of Suicide, which I did for 2 years in the federal government for the White House and the VA. Weeby Life is using technology. What do? So we develop strategic messaging campaigns that engage and educate communities while directing those in need to services. We use platform, iOS, Android, we have it all. We integrate tools and resources to improve behavioral health outcomes, and then we can track that so that people better understand Wow, this helped me last time. I'll try that again. Or this helped someone like me. I'll give it a whirl. We assess, enhance, and monitor the emotional well-being of those who are on our platforms. Very simple, easy tools. We don't share anybody's data, but we use these capabilities and these tools. This kind of stuff is available to all of you, whether it's with a company like ours or others. And finally, for Weeby, what we do, what we're excited to lean into is help develop, train, and certify peer support networks so that we're reaching those who have lived experience to help them support those who need their help. And those peer support folks, they can help get somebody who needs to see a mental health professional the care, the treatment that they deserve. So we have a bunch of different platforms, capabilities. We work with organizations like state directors of Veterans Affairs. We work federal government. We work with community, nonprofits. We're just getting ready to launch a new project with a national nonprofit. I can't say who it is yet because they'll announce it, but it's a VSO that you all know and love. And so hopefully you'll see us coming to your community soon. I love Rhode Island. I've worked with Rhode Island efforts before when I was with Give an Hour and Prevent, and I'm thrilled to be asked to be here today. Thank you, Director, for the opportunity.
WeBeLife.com. Say it with me, class. WeBeLife.com.
Thank you.
You know, I think, you know, Doctor, you said it best, you know, AI is here, you know, technology. I remember you often talk about trying to get ahead of things.
Yes.
And it takes us there. But to your point, it's just another resource.
Yes.
A tool that gives us the ability, because we know that getting assistance look different for all of us.
That's right.
Some people thrive in that space. Some people not so much. But we, like I said, I don't know, Vice mentioned it about you can't remove or take away the human aspect of things. I guess that's the premise around ask. You know, about reaching out to do the check-ins.
That's right. And to your point, one size doesn't fit all. But here's what we're finding. I'm not a youngster anymore, but even I have learned to actually enjoy some of the benefit of using technology. So the more people learn, the more they can help others learn. Together we can do this. We can get there.
Absolutely. Well, Doctor, as always, thank you. We follow your journey close. Your leadership continues to inspire us all. Safe travels.
Thank you. Thank you. It's an honor. Thank you. Take care.
Wow. We are rapidly coming to a close, team. This is the fastest hour in show business, that they should say. But, you know, our program continues. And, you know, as we turn to an area of growing need, our aging population, mental health support for our older adults and adults with disabilities. The Rhode Island Office of Healthy Aging, OHA, ensures that these individuals receive the care, or respect, and connection they deserve. Representing the Office of Healthy Aging is Stephen Boudreau, Director of Equality and Engagement, who will speak on the art of checking in, supporting loved ones while supporting yourself. Steve, how are you, sir?
Thank you. Good afternoon, everyone, and thank you, Director Yarn. Thank you for allowing me to participate today. Conversations like this, they matter, and I'm really honored to be part of it. At the Rhode Island Office of Healthy Aging, OHA for short, our work is all about supporting older adults, adults with disabilities, caregivers, and families. We want people to live full, connected lives with dignity and joy, not just survive, but truly thrive. So when we talk about the ASK framework and checking in, we're not talking about formalities. We're talking about real human connection, the kind that says, I see you and you're not alone. It's not about having the perfect thing to say. It's about showing up fully with patience and presence. OHA's programs like our Senior Companion Program, the Aging and Disability Resource Center, our Adult Protective Services and Caregiver Support Initiatives are designed with this in mind. We're not just plugging people into services. We're fostering belonging. So here's a quick reality check. Right now, older adults are about 18% of Rhode Island's population and growing. By 2030, nearly 1 in 4 Rhode Islanders will be over the age of 65. That's 264,000 people, plus their caregivers and families, all navigating health challenges, mental well-being, financial stress, loneliness, and isolation. The CDC provides some staggering numbers that are hard to hear. Social isolation bumps up the risk of dementia by 50%, heart disease by 29%, and stroke by 32%. These are not insignificant numbers, and they apply to all of us regardless of our age. But here's the hopeful news. Checking in equals connection, and connection equals preventative care. Small actions can make a big difference. When we check in, we're literally supporting better health outcomes. So what does checking in actually look like? When it's done right, it's not just quick, hey, how are you? It becomes a meaningful connection. And when we approach it with care and intention, it becomes a powerful source of emotional support for the person we're checking in on, and honestly for us too. One thing we emphasize at OHA, presence matters more than productivity. Our staff, our senior companions, and our volunteers, we all work from this belief. We prioritize people over tasks, relationships over checklists. Whether it's through wellness calls, home visits, or navigating resources, our teams are trained to spot the subtle signs of isolation, lonely, and depression, things that often go unnoticed. We're paying attention to the whole person, not just their case, because aging, disability, caregiving stress, and even abuse and self-neglect are isolating experiences. So this is where thoughtful questions come in. When checking in, it's about going beyond the surface, moving past the generic, how are you? Because let's be honest, that rarely invites a real answer. Try shifting to what's on your mind today instead of how are you? Would you like to talk about what's weighing on you instead of what's wrong? Would it feel good if I just sat with you for a bit, even if we don't talk, instead of why don't you go out or call someone today? These kinds of questions invite story, memory, and emotion. They remind folks of their identity, their worth, and it's about being seen. When we slow down, we notice things, mood changes, appetite shifts, subtle cues. Often, it's what's unsaid that signals the need for support. This approach is baked into OHA's culture, whether through our caregiver support networks, our wellness initiatives, or funded direct services. We always come back to the relationship first. Our Aging and Disability Resource Center can be a lifeline. Whether someone needs information, connection to services, or just compassionate ear, the ADRC is there. It's one of the best tools we have for making sure no one feels lost in our systems. And let's be clear, reporting concerns like elder abuse and self-neglect, that's an act of care and a legal responsibility in our state. We are all collectively responsible for the safeguarding of one another. Through programs like Adults Protective Services, the Senior Companion Program, Caregiver Supports, and more, OHA is here to help navigate these tough spaces. Our people, our staff, and our volunteers, they're the heartbeat of this work. They create meaningful connections that service alone can't provide. If anything I've said today resonates with you, or if you're thinking of someone in your life who might need a little more support, reach out. OHA has resources, tools, and real human beings ready to help, and the ADRC is available 24/7 at 401-462-4444. Thank you, Director.
So Steve, staying tuned, more than just listening, you've also recently had some transitions as well. Can you share with us what that's been like for you?
I have.
You care to share with us a little bit about that?
Absolutely. It's been a bit of a life change, a bit of a life change for me to be working with a smaller team. I'm here at the Office of Healthy Aging since November this year and really enjoying my 33 colleagues. I came from the Department of Health where I had been for 17, 18 years, with a staff of close to 650. So it's a bit different. The mission and the drive are the same, but the work is as engaging and exciting as it always has been.
Well, Steve, thank you so much, because your message, your mission, your work, your background has brought you to this moment, and your message resonates deeply with caregivers and the communities alike. So again, special thank you, sir, for your work. As we wrap up, I want to sincerely thank everyone today, our speakers, our community partners, and participants in our Mental Health Action Day. It's about more than recognition. It's about responsibility, civic duty, given the tool that God has given us to impact change. Let's commit to this year's theme, to check in with someone, to ask, utilizing the framework, acknowledge, support. Keep checking in. Don't give up on each other. Don't give up on us. Don't give up on me. Keep it in your prayers. These are 3 simple steps that can make a difference between someone that's struggling in silence or someone feeling seen, heard, or supported. Let's keep talking. Let's keep acting. Let's build a future where mental health is a priority, not an afterthought. I am personally reflecting on what we've shared today. I see the power in our community. That together, we are demonstrating in our ability to deal with the mental health needs. It's that well-being is just as important as our physical health and well-being. You know who it is, you know what it is. My name is Kasem Yarn, humble servant. Thank you. God bless. Take care of yourselves. Take care of each other.